Every other week, at least one patient tells me that they feel they can't breathe with the oxygen mask on before surgery. When this happens on the operating room table, I check the ventilator to make sure that they're actually moving air, and then I check their oxygen levels on the life support monitors to make sure they're actually getting oxygen to their body. And if everything looked normal, I'd reassure them that they were safe. I didn't understand what that panic felt like until it happened to me. I'm going to share what happened to me in a recent underwater panic that put me in the shoes of my patients before surgery who feel anxiety and impending doom, and how it completely changed my medical practice caring for patients struggling with anxiety and panic. And I'm going to demonstrate what I did on my body connected to the life support monitors for you to learn from, so be sure to stick around for that. That stuff freaks. After years of reassuring patients before surgery without actually experiencing what they were telling me, it actually happened to me. But it wasn't in surgery, it was underwater. I was scuba diving in some of the most challenging conditions I'd ever dove in, and once I was 100 feet underwater, I suddenly felt that I couldn't breathe. I was being knocked around by currents, and I was surrounded by sharks. It was one of my dreams to be scuba diving with hammerhead sharks in the Galápagos. But my air tank was running out of oxygen, and it was falling fast. And here's the kicker, because I had my mask, we call it a regulator in scuba, and I know that I had oxygen in my tank and I knew I was breathing. My brain knew I was safe, but I couldn't catch my breath. Lots of things can happen when you're underwater, like activation of your parasympathetic nervous system, what we call the rest and digest relaxation system. But paradoxically, there can also be activation of your sympathetic nervous system, what we call the fight-flight response, and that can actually be difficult to measure sometimes. I felt exactly like one of my patients when they're on the operating room table before they go to sleep for surgery. They feel like they can't breathe with the oxygen mask on their face, even though I'm monitoring everything on the life support monitors and I'm telling them that they're safe. They still can't catch their breath though. It's terrifying because deep down we all know that breathing is easy and automatic until it isn't. Changes in your breathing pattern are one of the first signs your body gives you when it senses that you're in danger. It's almost like a language that your body uses to communicate with you. We can ignore what our body is telling us, but eventually it's going to throw a stronger message at us, like increased heart rate or feelings of impending doom by flooding our body with adrenaline. And this was how I felt, especially with that oxygen level draining faster and faster in my tank as I'm beginning to get more and more anxious underwater. I even cut my finger on a rock and saw the blood rushing out of my finger underwater as those sharks were circling me. The problem as your anxiety increases underwater is that you breathe faster and faster and you drain more and more oxygen out of your tank, and you can't just take off your mask and breathe room air or ascend quickly to the surface. I'm just literally floating here, hyperventilating, powerless against the current, not unlike my patients before surgery. For those of you who have watched my videos before, you know I've done all sorts of tests on my body for you to learn how my body reacts to stress. And I meditate and I work out every day and I'm all like Zen-like in control of my body. Or so I'd like to think, because with all that said, I was working really hard and struggling just to hold it together here underwater. And I'm going to share with you exactly what I did, and I'm going to demo it on the life support monitors for you. I'm prepping the life support system here so I can demonstrate the anxiety-provoking breathing I started doing. Then I'm going to show you how I broke that with the parasympathetic breathing with my belly while you watch what happens to my body live on the life support monitors in both cases. White, right. Smoke over fire. Pulse oximeter. And now finally, breathing with the ventilator. I'm like $1 million man now with all this stuff connected to me. In green is the EKG, or the electrical activity of my heart. In yellow is the oxygen saturation of my blood. And the white is the carbon dioxide that I'm exhaling, so you know that I'm actually breathing. Every time that white line goes up, it means that I'm exhaling carbon dioxide out, and the monitor here is picking up that carbon dioxide on my exhalation. The blood pressure cuff is going up, and that's going to be the number in red that returns here in just a second. Almost there. Oh, it's cycling 2 times. That's never a good sign. 139 over 79. That's pretty stressed out for me. The other way to tell I'm breathing is to look at the green bag and see how much it inflates and deflates with every breath. You can also see the volume that I'm breathing by looking at this number here. Now I'm going to do rapid shallow breathing through my chest like an anxiety attack, so you can see what happens to all my vitals like the heart rate and blood pressure. And you can follow along by watching the carbon dioxide that I exhale to actually see how fast I'm breathing. You can see my breathing now, which was rapid shallow here with all those ups and downs on the white, and a blood pressure of 140/96. My heart rate is now in the 90s, and it's very exhausting and stressful to breathe rapid shallow through your chest. You see, if I really rapid shallow breathe, I'm only getting 100 to 200 cc's of air per breath. That's not enough to actually oxygenate your lungs. You can see what happened to my O2 sat there as well. It drops pretty fast. Some of that might be artifact, but some of it is also reflecting that if you're not taking a deep breath, you're not adequately oxygenating your lungs. We call it dead space ventilation, meaning you're getting air out of the places that can't actually absorb oxygen in your airways and lungs. All right, let's go into parasympathetic rest and digest mode now. I'm going to count my breaths, breathing in and then slowly breathing out for about 10 seconds per exhalation, and watch what happens to all of these numbers here. You can hear that my heart rate has dropped a lot. My heart rate variability is significantly increased, and my blood pressure has dropped to 96/48. That's from breathing through my belly, meaning that as I breathe, I feel my belly coming out and in instead of my chest moving out and in with every breath. And by exhaling out slowly with higher tidal volumes, they were over 1 liter when I was breathing out with those slow, controlled breaths. So to summarize, my heart rate variability went up, my heart rate actually went down, the tidal volume, meaning the volume that I was breathing in and out with every breath, went up, increasing my ability to oxygenate my body, and my blood pressure went down. That's some serious Zen-like states that you can get into without any medications. I'm not going to pretend like this can solve all anxiety out there, but I know it saved me underwater from spiraling into a dangerous, life-threatening place. This should never be a substitute for seeking care from a medical professional or going to the emergency room or calling 911, but if it's a known situational stressor like before surgery, I want you to feel empowered to fall asleep as relaxed as you possibly can, because that'll influence how you wake up. It can also influence future surgical complications, so it can literally be life-saving. To learn more, visit my clinic's website at www.claris-health.com, linked in the description below, and share what you've learned with loved ones. Please hit that like button and subscribe to keep up with all of my medical content. And remember that you have more power over your health than you've probably ever been told. And if you want a trick for taking the stickers off, get an alcohol pad and just start to rub away slowly at the edge of the adhesive. I also like to cough when it's coming out, like 1, 2, 3. Not much of a wax.